Hello, 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 and welcome to The Light Lupus and I, where I am your host, Salathiel Deloach, where we'll shine a light on the journey through autoimmune challenges and beyond. Today, I invite you to pause, breathe, and enter a space where we uplift, empower, and explore the intersection of health, hope, and healing. Together, we'll navigate the twists and turns of life with lupus, and along the way, we'll uncover stories that inspire, experts who enlighten, and tips that transform. So grab your favorite cup of tea, settle in, and let's begin this journey of strength, resilience, and community. Hello, everyone. And so today with me, I have none other than Dr. Joan Merrill. And I would love to bring her to the stage where she will encourage you and talk to us a little bit about lupus and her journey. So, Dr. Merrill, I love, love, love the opportunity to bring doctors on to the podcast and to tell us a little bit about themselves and what has inspired them to start their journey in the work that you do. So, if you would, I invite you to tell the audience just a little bit about yourself and why you started this journey.
Well, I got into lupus a little bit accidentally. I was in medical school and I saw a bulletin board inviting medical students to apply for a chance to do some research at the National Institutes for Health. So I was really kind of intrigued and called the phone number and was immediately told, come on down, you can do one of your fourth year elective rotations with us. So I showed up in Bethesda, Maryland, all ready to do a rotation, and walked in, and somebody at the desk said, who are you? And I said my name, and they looked on this big long list and said, you're not on our list. And then there was this little voice behind them who was one of their junior rheumatology fellows. And he said, oh, yeah, I invited her. And then the big boss came out and said, no, you can't just invite people to come here. She has to go home now. So I just sort of stood there and said, this is my fourth year elective rotation and I can't go home now. I have to stay. So they let me stay. And I ended up doing a lot of work in research on animal models of lupus. And that got me just fascinated by what could possibly be causing lupus. Lupus is very complicated. And what could possibly be causing it. And I guess the rest is history.
History indeed, because you have been doing some amazing work in the lupus community. And so I would love to first start out with the space of just telling us a little bit about, can you share a little bit about the current work that you're doing with Oklahoma Medical Research Foundation and how is it contributing to the advancing of lupus?
Well, one of our problems has been that over the years, and this is many years after the story I just told you, we have learned a lot about the cause of lupus in the immune system and what it is that's sort of a little bit out of balance in many patients. So they've developed a number of really interesting, I have to call them 21st century drugs that target specific little proteins in the immune system. And all of them ought to be relevant to helping restore the balance of the immune system in people with lupus, or at least with some people with lupus for each drug. Because not all lupus patients are alike. So one drug isn't going to treat everybody with lupus. But we've gotten a technology now where we can figure this out. It's just going to be complicated and it's not going to be all that easy. The problem is that trying to test these drugs the way that the government requires you to test drugs, certainly it's appropriate that you have to test them for safety. But to try to figure out whether they're effective, this is kind of tough because the government wants you to test them in all the lupus patients
Hmm.
But it was not going to work for all the lupus patients. So, how do we get at that? And that's pretty much the work we're doing in Oklahoma. It's this idea called precision medicine, where you try to figure out which of the patients might respond to this drug as opposed to some other drug.
And lupus is such a complex disease with various manifestations, like you just said. Who are you going to determine who you're going to include in those trials? So, what are some of the methods that you all use in determining who is going to be a part of the trials?
Well, here's the problem. The regulatory agencies, because I'm talking around the world now, these trials are international. So it's not just the FDA, it's the regulatory agency in Europe and those in China, all the different regulatory agencies have rules about how they want you to conduct a trial. So,
Hmm.
in fact, you have to conduct a trial that includes a very diverse spectrum of lupus patients. Now, when I use the word diverse, I'm no longer talking about somebody's ethnicity or
Right.
race or country. I'm
It's
talking
bigger
about
than that
what's
now.
inside in the immune system. And I can
Yeah.
tell you this, it doesn't just go by race.
No.
It goes by all kinds of complicated little, just a spectrum of overlapping immune disorders in people of all races. So we have new ways of figuring out how to sort people out, not based on anything cultural at all or anything
Hmm.
racial at all, but based on, okay, what in this immune system needs to be rebalanced. But now we have to do a trial with everybody. And
Okay.
here, it may not be a good idea to have so much diversity because we want people who are likely to respond to a drug. And those for whom are not so likely to respond to that particular drug, they need to be in a different trial of a different drug. I hope that makes sense to you.
It does. It does.
But they won't let us do that because you never know. And they're sort of right. I got to say, they're sort of right because we don't know so much. We could be missing something. So
Right.
how you have to go about this is you have to design a trial, and early on when you're testing the drug, you're really happy if it works in, maybe half the people. That's good. That's a good result. Uh, and then what you want to do then is figure out, well, which half is that? What's going on in those people that makes them more likely to respond to the drug than the other half of the people? So little by little, we'll learn more about what we're doing. So the entry criteria, and I know a lot of people with lupus are just frustrated because they might want to be in the
Absolutely.
trial and they're told I'm not eligible, right?
Right. Right.
The entry criteria, and I'm as frustrated also. You have to be sick. You can't be too sick, and you have
Hmm.
to have these certain restricted things, or the government
Yes.
thinks that you shouldn't be in the trial. And
Right.
so, if you are on, let's say, you're on a background treatment with or Imuran or azathioprine, and let's say just that month it made your liver enzymes get a little bit high. Well, you're kicked out of the trial, but
Right.
you and your doctor know that if you just, stop the drug for a week or so, they're going to come right
You're
down.
gonna level out. Hmm.
Too late, you're out. Now
Yeah.
sometimes they let you rescreen later, but it just turns into this process.
Yes. Sounds like a never-ending process.
Never ending process. Yeah, that's right.
Yeah. So, what current research or treatments are showing promise for helping to manage or predict flares?
Actually, there is work at my institution by Dr. Judy James, who has
Hmm.
actually found certain immune proteins that tend to go up. But again, remember, none of this kind of research applies to every single person with
Right.
lupus, but to large subsets of people with lupus, so that it's kind of worth testing because if you see it go up, which you will a good percentage of the time, it might be able to predict flares. But
Yeah.
it's not going to work for everybody.
And I think that that's an amazing and awesome thought. Just as someone who has been diagnosed with lupus, to know that there is work that is being done in that field to try to predict the
Yeah.
space of when we are going to have a flare. Because, I always tell people that, finding myself in a flare can be so disrespectful and inconvenient, just when life is just going along.
Yeah.
Being hit with a flare is just It's
Well,
just
yeah, I
so
mean, don't you have
inconvenient.
enough things you got to worry about?
Exactly.
You already
Just
had
a
stuff to worry about.
exactly. Like we're living regular life and battling the regular trials of life. And
Yeah,
then to have something that just pops up on you
yeah,
out of nowhere, really with no expectation of it. Because as you mentioned just now, we think that we're doing well and we think that everything is going okay. And then something just pops up. And
yeah.
we know that space of sometimes you can just, shift the way you're taking that medication, increase talking, of course, talking with your doctor first, but
Mm.
increasing that medication or decreasing that medication can help. But sometimes there are just those cases
Well,
where
sometimes you're a little late and
exactly,
day late and a dollar short, right?
exactly. You just missed that mark, and it's not that easy where you can just shift some medications. You have to, it's a process to
Yeah.
go through to get things to, regulate.
Well, so we have some traditional medical tests that your doctor I know is doing that can help also to predict some flares. So, your little complement proteins start to
Hmm.
go down. If you have, not everyone does, but if you're a lupus patient who has antibodies to double-stranded DNA, they start to go up, and you kind of know that you don't know they will flare, but you know they're at a greater risk for flare.
Right.
And they did a study at New York University, really like at least 10 years ago, maybe before that, which was really interesting, but I don't think anybody really follows it in clinical practice. And they said, well, what if we see the complement going down and the DNA going up in patients who had that? Remember, this is the subset of lupus patients who had that in the first place. But we see that trend happening where they're doing this, and we just give steroid. And I mean, who wants to take
Hmm.
steroids? But
Right.
everybody had to get the same thing, so it was like a study. Said, what if we just give some steroid right then? And they actually showed that they could in the group where they gave the steroid versus the group where they didn't give the steroid, there were fewer flares. So they were able to sort of predict and stave off flares. I mean, I don't want to make this into such a great thing because it wasn't everybody, because they still
Right.
had flares in both groups. And, people, not everybody has that in the first place. So it's not perfect, but it was just a beginning of an understanding that we may have the technology. Um, and if we just do the work, we may be able to find for individual patients their own predictors of flares.
Right. What are some common misconceptions about lupus that you've encountered, and what are some ways that you help patients navigate that misunderstanding that takes place?
Oh, my least favorite, because I don't want to say my favorite, my least favorite is patients are told that their body is attacking them.
Yeah.
I think that is the most pessimistic, mean spirited kind of way of
Mm,
looking at lupus. So I explain to people that your immune system is not there to attack you. Your immune
mm,
system is there to defend you, and you're just out of balance. And how do you get out of balance? Well, you get out of balance because you inherit all kinds of little proteins from your mom and your dad. And so you're unique, and your immune system is unique. And in your unique immune system, something has gotten in your body because, things are coming in all the time. I mean,
absolutely.
I'm crawling with bacteria. They're just like, you want a horror movie, get an electron microscope and put it on your skin. But anyway, I'm crawling with bacteria, and they're all getting in, and everything's getting in, and viruses are getting in, and toxins are getting in, and the air's polluted, and and all kinds of stuff like that. And my immune system has to handle all of that.
Yeah.
And so if you inherit, just the combination of proteins where one of those little things is going to trigger you off to get sort of revved up, that's when you get lupus.
Yeah.
And why can't we all have perfect immune systems? Because none of us do. Now, here's a thought. You know, our immune systems are doing a lot of work. They're staving off infections for us, and they're also staving off cancers. Our immune system attacks cancers.
Yeah.
Most of us probably have a lot more cancer than we ever knew about because it's gone, because our immune system takes care of the beginning of it. So I like to say to people, here's a philosophy. Maybe you have lupus because there's something else you don't have. You don't know,
Mm,
right?
interesting way of thinking.
Yeah.
So really realizing what you just mentioned, the space of we probably had numerous amounts of cancers that existed in our body, but because we suffer with this autoimmune disease that is, doing so much fighting with inside the body, or within the body, that we missed. Luckily,
Well,
we missed.
here's how I would put it. I would put it more like this. First of all, it's not always a cancer. Maybe it was
Right, right.
virus. Maybe it was a toxin. Who knows what it was? But it was your unique structure that got in your body that you don't that just revs up your immune system like crazy, right? But you took care of that thing, but now your immune system's out of balance. That's what this is.
Understood. Thank you for the clarification too. Because I definitely don't want to steer anyone that's listening um, astray at
No,
all.
I don't want to say. I mean, it, who knows what it is, but we
Right.
do know this. We know that certain things happen. There's an association, for example, with the Epstein-Barr virus, so we kind
Hmm.
of know about that one, and so, in fact, it's been shown that that's one of these viruses that like gets inside you, and then every once in a while, it sort of pops out into your bloodstream. They've actually shown in some patients that when that happens, it causes a flare. So, you know, but it's not the same thing for each person, is all I'm saying.
Right. Understood. Understood. With new treatments like biologics being developed,
Mhm.
what do lupus patients need to know about these advancements?
Well, first of all, I worry about the hype. So every
Okay.
time there's a new idea, in fact, recently I've been sort of appalled because a very good scientist in lupus, one of the top scientists in lupus, has discovered a very interesting protein that may have something to do with lupus and has some very good data. But the news media got hold of it and they're hyping it as this is going to cure lupus. Well, it's just misleading because, first of all, no drug has been developed and nothing has been tried. And it's sort of like, what they say about elections, the only important poll is election day, right? So curing all lupus with one approach is extremely unlikely. We kind of already know that. Like I said, it's going to be some subset of patients where this might be very helpful. So I worry about the hype. I think it's not fair to people to we're in a lifelong. I don't want to call it a battle because I don't like this attacking language, and I don't like
Hmm.
we're in a lifelong endeavor, a lifelong endeavor to get that immune system back in balance.
Do you mind giving us a sense of how treatments are becoming more tailored towards individual patients?
Yeah. So we know that most children with lupus and about half of adults with lupus have a, a really strong activation of a certain kind of protein called interferon.
Hmm.
And it's more likely to be a type of interferon that's called type 1 rather than type 2, but really both are involved. And so we kind of know that, and we kind of know some patterns of what happens when that get activated in terms of how the other proteins in the immune system will
Hmm.
react. So we have patterns that we can see kind of on, we call it a heat map. So proteins that are getting activated, maybe they'll look yellow, and proteins that are not so activated, or they're more like a healthy, when you're healthy, they'll be more like black. And then down below that, they turn purple because they're lower than usual, right? And so we can actually classify lupus patients into these patterns. And when you see these patterns, you go, maybe it would make sense to try drug X if you have this
Mm.
pattern. And we actually have some very, very early data. It's not proven or anything like that, suggesting that you might be able to sort of sort out, which of these groups of people were more likely to respond to a certain drug. And we've got some published information on that, but it's all got to be done again in a different population of people to see, to science is slow. You have to, are you sure that's right? Or was that a
Yeah.
fluke, right?
Yeah.
You have to be sure it's
Most
not a
definitely.
fluke. But that work is ongoing now, and people are thinking like that now. Now, is it perfect? No. Is it better than how we do it now? Yes. So we'd be a little bit more likely to get you the right drug the first time. It's not going to be 100%, but instead of 40%, maybe we're going to get up to 70% or
Right.
80%. And that would be a better chance to get better with the first drug we try, right? Yeah.
That is true. That is true. Um, as a lupus expert, what lifestyle changes or even holistic approaches might be recommended or be able to complement the traditional treatments for lupus patients?
Well, you can't run a marathon if you have arthritis. Uh,
Right.
but to the extent that you can get some aerobic exercise, whether it's swimming or if you can walk pretty well, right? Walking is actually turns out. I wish I knew this when I was younger, but I finally just pooped out. I couldn't run anymore, and I was getting
Mm,
fatter anyway. And I said, "Uh oh, now I'm getting fat because I can't run anymore. I've injured my knees and all this stuff." I said, I think I'm just going to try walking. And you know what? It works.
yeah. Yeah.
And you feel wonderful if you can walk. But I think if you can't walk, maybe you could swim. And not everybody can get to a place where they can swim, but something, right?
Yeah. Yeah.
Or even chair exercises, whatever you can do. Exercise is really important because if you don't use it, you do lose it and you get out of
Absolutely.
shape. And that first of all, it makes you more likely to get a flare because you're deconditioned. So conditioning is
Right. Right.
the advice for a diet is healthy diet. It's not different from anybody else. It's just that you're going to pay a higher price if you don't eat a healthy
That's
diet.
true. It's true.
Yeah,
I like to encourage people to eat the rainbow. The more colorful the plate, the better.
absolutely, absolutely.
Yeah, in that space of, you talked a little bit earlier, that space of when you have to take those steroids and
Yeah.
the extra hunger
Oh,
that
and what it does
exists,
to you. Oh yeah, you turn into me with a big belly.
the
Horrible.
round, the
And
round
young
pie
people, that
face.
happens to young people. They don't like it. They don't like.
No, don't like it at all.
But I would also say something very important. You just got to find joy
Yeah,
because joy is one of the best um, immune, I don't want to say stimulator because lupus patients have some overstimulation in their immune
yeah,
system, but immune strength.
yeah.
Joy is really important. Now, you can't take away the clouds. You can't, all the bad things that have happened and all the stresses and all the
Hmm.
difficulties, you can't make them disappear. Joy is not pretending that you don't have troubles.
Right.
It's just finding something to be joyful about. It
And
really
that was
is therapeutic. Yeah.
And that was definitely one of those light the way moments, encouraging, we want to definitely make sure that even though we're giving information, that
Yeah.
space of stopping, pausing in the moment to take that time to
Yeah.
encourage the patient in spite of the things that we are going through to still, see some positives that are happening in life. Everything isn't all gray. It isn't all bad. There
Well,
are
just
good
how
things.
about how beautiful a flower is, or
Yeah,
how lucky we are to be on this earth to see it. When you see these
absolutely.
pictures of Earth from space, it's beautiful.
Yes,
And we forget that.
most definitely.
And
Most
things
definitely.
people have created, art, and just take that time and make yourself look, because I know it's just very therapeutic.
Absolutely. And I would love to pause in a moment to address some of our presenting opportunity for our patients who are newly diagnosed with lupus. What are some of the most important steps they could or should take early on in managing their conditions effectively?
Well, most people who get lupus did not read the medical textbook first.
Hmm.
Most people don't know very much about lupus. So
Very true.
early on, try to learn a little something about it. And there are lots of good educational forums. The problem is the internet's kind of full of
Oh,
misinformation.
yes. Oh, yes.
You can go to the Lupus Foundation of America and they can guide you to things that are reputable. Um, and the other thing I think is to pick your doctor wisely.
Hmm.
I think you really do want to be able to see a doctor who has some experience taking care of lupus patients. But beyond that, uh, it's no good if you're, ushered in for a 5 minute, you know, uh,
Ah,
and then
those.
pushed out, and then you really want to go somewhere where there's just a little bit more peace and calm, and they're communicating with you, not at you. And you deserve that, and you can demand that. and you can
Absolutely.
doctor shop until you get that.
And that's doctor that's doctor communication telling you to that you have a choice in the doctor
You have a
that
choice.
you
You're the patient. So, but here's the thing. By the way, have you ever wondered why they call people patients? Think about
elaborate.
no, no. It's the assumption is you have to be patient.
I was about to say the same thing
Well,
to you.
why do
Yeah.
you? Well, when I go to the doctor, they say, "Oh, are you the patient?" And I go, "No." I said, "I'm not patient."
That's a good one. I'm gonna have to remember that one. I'm not patient.
Not patient.
That's a good one. That definitely is. And
Yeah.
good information, because, when I was first diagnosed with lupus, a lot of times when I went to the different physicians, I would sit in the physician's office sometimes an entire workday.
Yep.
You
And then
know,
you get a 5 minute visit. Yep.
exactly. I get my 5 minute visit back in the back,
Yeah.
but that space of being overbooked, and realizing them not realizing or accepting that my time is just as valuable
That's right.
as theirs is, and realizing for me that I had a choice to make whether I wanted to continue with that doctor or if my time was of any value to me
Yeah.
and if I wanted to, find someone else. And sometimes it's trial and error. You don't just have one and try the next one and it all works
No, no. Well, you
mysteriously.
don't want to. You also don't want to jump too fast
There
because
you go.
people are only human as our doctors.
Right.
And I've lost a few patients over the years from
Hmm.
total misunderstanding.
Yeah.
Sometimes if there's 15 things going on, it looks like you don't care. Maybe you really
Hmm.
do care. So,
Hmm.
I really advise people to confront their doctor.
Yeah.
Say, hey, you made me feel bad, or whatever it is. Hey, I need more time, or right? Because you'd be
Yeah.
surprised. Some doctors are just they have bad days too, and
Yeah.
they may be able to. I learned very early in my career that there's nothing illegal about saying to someone, I don't have time today, but if you want to come back Tuesday,
Hmm.
I'll make sure there's time for you.
Yeah.
That's a solution, isn't it? You don't have
Yeah.
to argue or get defensive. Just, try to work it out.
And that was a space that where I was headed. I was getting ready to say that space of, establishing a pattern.
Yeah.
You have those conversations with the physician, and even after that conversation, that pattern continues. Then that's the space where you realize that,
That's
hey,
it.
I may need to consider
Yeah.
finding another doctor. But realizing that even the next doctor may have the same situation that exists, but you have to be the responsible adult to have the conversations and establish patterns, and if
Yeah.
those patterns happen,
Right.
then that's a decision that you have to make.
You have to
But
give people a chance,
right,
but you do not have to sit there and in a situation that's not good for you.
right, absolutely,
Yeah.
absolutely. What are some make? Go ahead.
No, no, that was my computer dinging about.
The computer wants in on the conversation.
Well, with AI, be careful. They may start like talking in the middle of these things.
That
Excuse me,
is so
that's
very
wrong.
true.
I'm going to try to,
So
my
very true.
information suggests.
What are some major challenges researchers face in finding a cure for lupus?
Well, like I said, I don't think there's going to be a cure. I think there's
Hmm.
going to be just much more sophisticated ways of helping people to stay well, if that
Hmm.
makes any sense. Well, there's no cure for anybody. We're all
Anything, right,
going
right,
to
right, right.
die.
That's inevitable.
So if you look at it like that, it's not such a bad thing to say there's not a cure. But what we'd like to do is we'd like to live as long of a life as is feasible, all of us. And if
Right.
we have an illness, we want it controlled. That's
True.
it.
Absolutely.
So
Absolutely.
that I think we can eventually get closer and closer to. But the major challenge is really it boils down to one word: funding. I
Yeah.
don't think of this as rocket science. It's just tedious work. You have to work really hard and follow. Like that guy who found that one protein. That took his
Yeah.
whole career, right? But that's
Absolutely.
okay because that protein's a piece of a very important puzzle.
Yes. Yes. A long journey still to
It's a long
continue.
journey. Long journey.
Yes. And you actually kind of shifted into my next question. How can patients and our broader community support lupus research?
Well, I mean, if it's mouse research, then you can make a donation to some foundation. If it's human research, you come to the question of, should I be participating in that?
Hmm.
And the answer is not yes for everybody, and the answer is not yes for anybody all of the time.
That is true.
But there comes a time when you might say, you know what, I'm ready to participate in some research. You have to, if you're going to do that, you have to know what's the study about, what's my role in it, if I'm going to be actually taking a test drug or an intervention, what's known about the side effects, what isn't known about the side effects, how are you going to handle it if I get side effects? You want to know
Yeah.
all the information. What's the plan here, right? And then when you participate, you've got to be an active participant, and the doctors working with you, they better see you as an active participant
That's true.
so that
That
you're
is true.
informed about everything. For example, I don't know if everybody knows this, but it's a patient's right. Patient, I hate that word.
It
Work for me because I know
just falls out, honestly.
it's a person's right, when they're participating in research, to know if something new is learned that could affect their willingness to continue.
Right.
Absolute right. It's practically a law, and a doctor can get in trouble if they don't tell you. But I can assure you, people just don't think. They don't.
Mm,
So you want to make sure you've got that kind of communication at the site.
absolutely. Can you explain how some of your current work is addressing the underlying causes of lupus?
Uh, I think only backwards. So my work mostly involves testing drugs.
Okay.
So, well, it's other stuff too. It's stuff like how do vaccines react in the body and things like that. But if you're testing a drug, in fact, that is an opportunity to learn about what goes on in lupus. So think about it like this: you look at the people who got a good clinical response, and by clinical I mean the arthritis got better, the rash got better, something got better, right? And then you look at the people who didn't get better, but they got the real drug, right? Then you've got another group, which are people in the placebo group, right? Who didn't get the drug. They got a fake drug. And then what you do is you compare things in the immune system, how that those people were before the drug was given, and that's how you would maybe predict who's going to respond and who's not, based on these blood tests from the immune system. And then you also want to know what changed when the drug got in the body. Which of these things actually changed more towards normal, and which didn't, because maybe they're not relevant. So that's kind of, when you do that, you kind of begin to understand how lupus is working in that person. So you're actually going backwards to you start with, we all started with what's going on in that immune system. Then we test a drug that looks like, oh, that might work for that, right? And then you go back and you say, well, what did it do in the people who got better? And what didn't it do in the people who didn't get better? So think about this. There's more than one possibility why a drug doesn't work in a person. Maybe that person never had the exact problem that the drug fixes. That's one possibility. Maybe the drug did affect the exact right thing in that person, but not enough. That person might need a bigger dose, right? In lupus, we found out some people get too big of a dose and it tips the immune system in the other direction. So remember, I told you lupus is an imbalance. So it's not like you fix one thing and make it go away. It's more like you're tipping it. You're tipping try to get a good tip. Give too much drug and you're going to go over like that. You're going to fall over. So that's not good either. And then finally, it could be that the person is taking other drugs in the background that are interfering with the drug, or has another whole thing going on that this drug doesn't address, but maybe it addressed really well the thing it was supposed to, but we need to give another drug on top to get to that other thing. So all of those are possibilities, and that's kind of the work we do. We try to straighten all that out using the treatment trials as a way to understand the lupus and the individuals better. I'm just sitting here because things seem to have stopped. But I'm suspecting that our host has technical issues, which is okay because she's back.
Can you hear me?
Yes.
Okay. So that means you did not hear my question.
No.
Instead, could you discuss, excuse me, the role of biomarkers in your current lupus research and how they might improve early diagnosis or target therapy?
Well, that's those things are biomarkers. Everything all those little proteins I was talking
Hmm.
about fall under biomarkers. That's what they are. So we take a blood test, and we know a lot about lupus already because I told you that we kind of see patterns of immune activation in different lupus patients. And we also know that when you get on different treatments or when you flare, you can actually change your pattern into one of the other patterns. So remember what I said about balance? Nobody has like a kind of lupus. They sort of go from pattern to pattern depending on what's
Hmm.
going on. It's like an imbalance. So you're falling from one lupus pattern to another lupus pattern, but when you're well, you're falling into more of an inactive pattern that's more like a healthy, your healthy self. I don't like to say that they're a healthy person and you're not because maybe
Right.
they have diabetes. I don't know what they have, but I'm just saying more like when you're healthy, right?
Yeah.
So it's really following the patterns more than just one single biomarker. So there's an array of biomarkers that comes into a pattern.
Awesome. Awesome. And so, final question.
Yeah.
If there is anything that you could leave our listeners with, what might that be?
I would just say be relentless. I don't know why we were put on this planet, but I suspect we're all here to learn. People have faith, and that's a good thing. But if we were just puppets, right? Why would we
Yeah.
need to exist?
True.
So I think we're supposed to learn. And so whatever gets thrown at you, whatever awful thing gets thrown at you, including lupus, I think the more you can learn about it to try to understand it, that's grace, that gives life a purpose.
Yeah. Well, we want to thank you, or I want to thank you for joining us here today on the Light Lupus and I. The information that you have provided and shared with the audience has been invaluable, and I thank you for joining us today.
Well, I'm honored to be invited, and I had a lot of fun, and I appreciate you.
I'm glad to hear that you enjoyed yourself. Family, what an awesome time we had today here on the Light Lupus and I. I am so hopeful that you learned new information about lupus and some of the things that are involved. I hope that you were empowered here during this time, and that as we explore the intersection of health and hope and healing, that you truly felt that you gained some knowledge. And so I thank you, and I hope to see you all again. If you're here for the replay, I ask that you type replay to let us know that you stopped by and that you listened in on our show. Have a blessed day.